Have you started to notice fine lines in your forehead, in between your eyebrows called the 11s, crow's feet, or changes in your brow over time? Any of these are reasons why you might want to talk with your injector about addressing the upper face. So, upper face is best addressed with Botox. Botox is wonderful for smoothing out fine lines and wrinkles, and in some cases, we can even deliver a Botox brow lift. Now, it's important when addressing the upper face that we Botox the entire upper face. There are 3 muscle groups that are all opposing. So when we inject just one muscle group, the other 2 can actually get stronger and create a modification in the brow that you might not like. You can also end up getting lines and wrinkles in places that you didn't have before. So it's important to address all 3 areas. You might notice that you need a temple restoration if you've seen the lateral third of your brow, which is like the side of your brow, kind of start to duck behind the bone right here on the side. That means that over time, the deep fat pads that are in the temple have kind of wasted away, and you've lost that volume and structure in the temple, which help to support the eye area. So when addressing the temple with dermal filler, it's important to note that this is a high-risk area. It's high risk for things like blindness and stroke. Of course, that sounds scary. I'm going to explain everything that we do to avoid this complication in the office. Number 1, we have an ultrasound in office. We're one of the only clinics to have one in Orlando. We make sure that we scan the temple first to do something called vascular mapping, which is where I find exactly where the blood vessels are. I mark them out to make sure that we don't disrupt them while we're injecting. This drastically decreases the chance of us accidentally injecting into a blood vessel, which is what causes the blindness or stroke. The other safety measure that I utilize is I pull back on the plunger every single time I inject. That means if I'm ever in a blood vessel, it should flash red and say, "Don't inject here." Then I pull out, I change the needle, and I go somewhere else to inject. Also, we only use dissolvable filler in these areas of high risk, so that way if we do accidentally inject into a blood vessel, we can quickly reverse it with our 20 vials of Hylenex that we have on hand. Hylenex is the reversal agent that we use to break down the dermal filler. Threads can be used to lift your brows. Now, it's important to note that threads can be very finicky. They do require that you have facial rest for an entire month. You actually can have a headache that lasts a whole month as well. So it's very important to talk in depth with your aesthetic provider about this treatment before going forward with it, so you understand the downtime and healing process. To maintain your smooth forehead, you'll want to come in to get your Botox maintenance every 3 to 4 months, especially for your first 3 treatments. After that, sometimes we can start to stretch you out to 4 or 5 months. We don't change your dose, we just stretch out the intervals. Temple filler should be maintained once a year, and threads for the brows are also once a year. Botox for upper face lines is best used as a preventative measure. So you can start using Botox as early as your early 20s just to prevent you from getting those lines and wrinkles in the first place. It can be used after those lines and wrinkles are already present at rest. However, it's important to note that you will need to commit to 3 treatments at 3-month intervals at the full dose that we set for you in order for me to really make a difference in those lines. The skin and muscle is in a constant tug of war. We use Botox to relax the muscle's tension on the skin, but we also need at-home skincare and medical grade facials in office to truly maximize your result.